Morning for Today's Health is Randy Vawdrey, and he's a nurse practitioner and chief operating officer for Physicians Immediate Care. And today we're talking antibiotics, when you need them, when you don't, and what they kind of actually do to your system when you take them. So first off, were saying you've seen a lot of people, they get sick, they're asking for antibiotics right away. I guess first off, when do you actually need them?
Great question. So there's three things that I would recommend that people consider before they come expecting antibiotics at the urgent care. The first one is, how long have they been sick? It's not uncommon that someone will come and say, oh, I woke up this morning with this terrible sore throat. Okay. I think I have strep throat. And the question is, how long have you had it? Well, I started this morning. That probably I would give it a little bit more time before you come seeking antibiotics, because about 90% of upper respiratory illnesses are viral.
Okay.
Number two is, what have you tried to get rid of the sore throat? Have you taken ibuprofen, or have you taken Tylenol? Those medicines can lessen the severity of the symptoms that a person feels and make you just feel better during the course of the day. In a couple of days of some anti-inflammatory medicine, a person might feel great.
Okay.
The third thing to consider is, what other illnesses does the person have? Logan, if they're healthy, you get up and you feel like going to work, but you just don't feel 100%, you probably don't need an antibiotic today, right? If you're a brittle diabetic taking insulin and you've had multiple health problems, we're more careful in those populations of people.
Okay. I had a lot of buddies, and I still remember this, in college who were, like you say, as soon as they got the sniffles, they're into the doctor's office, they're into student health, getting antibiotics. Me personally, I'm the person who puts off going to the doctor until it's too late. I guess what's kind of the good buffer area, the good area to be in as far as going to the doctor? How long should you wait? But at the same time, what is too late?
Well, that's a very ambiguous answer, because some people probably need to go to the doctor sooner than later.
Okay. So like you're saying with depending on other health concerns type thing?
So I use the health test. The health meaning, if a person comes to my office dressed up in their work outfit and they're on their way to work and they feel like they need an antibiotic, but they're well enough to go to work, they may not be ready for an antibiotic, right?
Okay.
You can kind of judge how sick a person is when you walk into the room and the women are done up and their makeup is done and they look beautiful and they're going 1,000,000 miles an hour and they're just there because they don't feel 100%, versus you come into the room, they're wearing their pajamas and they've melted into the exam table and you talk to them and they just moan, right? You can tell there's a difference in sickness in those individuals. And I often ask, well, do you have a fever? And people will say, yes, I feel warm. Feeling warm and having a fever are very different, right? And so we encourage people, check your temperature at home. You can feel warm and not have a fever, versus you check your temperature and it's 102. That's another warning sign.
Different thing. Okay. Now, when you actually get on antibiotics, how do those things work into your system? Obviously, they're going after bacterial infection, but what are they actually doing to your system?
Okay, so antibiotics don't do anything for viruses, as I've mentioned. And as you mentioned, about 90% of upper respiratory infections are viral in nature. Some antibiotics are bactericidal, which means they kill bacteria, and others are bacteriostatic, which means that all they do is inhibit the bacteria's ability to continue to increase and grow. Right?
Okay.
But antibiotics are not indiscriminate, meaning they don't just kill the bacteria that we want to kill. They kill all bacteria that's sensitive to them. And that's why so many people end up having loose stools or diarrhea, because our bowels are full of bacteria. And a surefire way to run into problems is overuse of antibiotics that give people colitis. And there's a lot of problems that can come with overuse of antibiotics and people clearing out their bowel of healthy bacteria.
And real quickly, mention the importance of taking your antibiotics all the way through, taking every dose you're supposed to.
Right. Yeah, so I hear this all the time. Someone will come in and say, I need antibiotics because I had 4 or 5 pills left over from my last course and I started taking them and I'm feeling better. And so now I need enough to finish that course. Right. And I think, oh, no, that means that the last time they didn't finish the course, right? That's discouraging. If you need an antibiotic, a licensed provider has the training to know how much antibiotic do you need and what length of time and what dosing and so forth. And for an individual to stop taking it early can perpetuate resistance in some of these superbugs that we're starting to read about from the CDC and the research companies.
All right, well, thank you very much for stopping by this morning.
You bet.